Modern diet and its impact on human health. What do you usually do when you're feeling hungry? Grab a pack of chips? Gulp down a can of soda? Rush to favorite burger joint and treat yourself to a hearty meal? If your answer to any or all of these questions is a yes, then you are among the millions who have fallen victim to the modern diet. The recent shift towards the consumption of processed food, sweetened drinks, vegetable oils, and other unhealthy alternatives is a primary reason why people across the world, even the young, are getting fatter and sicker by the day. Serious ailments such as obesity, type 2 diabetes, heart disease, cancer, and more have seen a profound rise over the years. In recent years, the relationship between diet and gastrointestinal diseases has received more and more attention. Chronic gastritis is one of the most common and insidious diseases in human beings. Hundreds of millions of people worldwide suffer from the inflammatory condition to varying degrees and extent. Chronic gastritis refers to a group of conditions that cause chronic inflammation of the mucosal lining of the stomach. There are too many different causes of chronic gastritis, but most cases are related to one of these following: Helicobacter pylori, bacterial infection, damage to the stomach lining, autoimmune conditions. However, the impact of the modern diet is obvious. Possible risk factors for the chronic gastritis include diet high in salt preservatives, diet high in fat and oil, especially saturated and trans fats, smoking, long-term consumptions of alcohol, conditions that weaken the immune system, cocaine use, long-term use of non-steroidal anti-inflammatory drugs, and some other medications. What is gastritis? Gastritis is a medical term for inflammation of the stomach lining. Initially, gastritis caused irritation of the stomach lining, and with time, it progressed into persistent inflammation that can lead to erosion, ulceration, and degeneration of the entire stomach. Gastritis can be acute, short-term, or chronic, long-term. Gastritis is the most common problem faced by many individuals in these days. Before going into the details regarding its symptoms and solutions, people need to understand the true condition of gastritis and what is involved. One of the most active organs of the body is the stomach, which toils hard to digest the food that nourishes our body. The inflammation, that means reddening, swelling, and irritation or erosion, is the protective lining of the stomach, is termed as a gastritis condition. The exact contributing factors of gastritis, especially if unknown, may be unavoidable. However, known trigger factors should be avoided as far as possible and at least minimized significantly, regardless of the cause of severity of symptoms. Making dietary and lifestyle adjustments may help treat gastritis or prevent it occurring. Common dietary suggestions of the people with chronic gastritis include avoiding or reducing alcohol consumption, avoiding spicy food, avoiding rich, oily, or fried food, avoiding acidic food, especially citrus fruits and juices, eating smaller meals but more frequently, reducing salt consumption, eating less red meat. Eating a healthy, balanced diet rich in antioxidant, fiber, and probiotics may also help. You find this substance in food such as whole fruits and vegetables, whole grain breads, cereals, rice, and pasta, fermented products, lean proteins including chicken, fish, beans. Possible complications. If properly treated, acute cases of gastritis are rarely associated with the complications. However, people may experience serious health complications if they have severe or untreated chronic gastritis. Erosion gastritis can cause peptic ulcers. Erosive gastritis can cause peptic ulcers. When an ulcer has formed, they have progressively degrade the surrounding tissues, feeding and enlarging themselves. Severe ulcers may eventually cause internal bleeding, which can be life-threatening if left untreated. Other possible complications of chronic gastritis include anemia caused by iron deficiency, anemia caused by internal bleeding, vitamin B12 deficiency, abnormal stomach growth such as polyps and tumors. When to see a doctor? People with symptoms of gastritis should see a doctor if the symptoms are severe, last for more than a week, do not respond to a treatment or lifestyle adjustment. Internal bleeding requires immediate medical attention. Signs of internal bleeding can include dizziness, unexplained weakness, paleness, black tarry stool, red fresh-looking blood in the stool, red blood in vomit or vomiting blood, unexplained drowsiness, difficulty breathing or swallowing, confusion, passing out. Thank you.